All right, so Steve, you're about 6 months from a total knee, right?
Yes.
And you had a pretty good experience with it. We used a robot, used some little tracker things on your knee. Can you straighten and bend it for us? And bend it back. Now, you had home therapy come over, right?
Yes.
Tell us about that.
When they showed up the first day, I was out in my driveway getting my mail. They were a little bit alarmed that I was walking around 2 days after surgery.
Now, where do you live?
And out in the country in Brookville.
So your mailbox isn't exactly on the front porch, right?
Probably 50 yards from the house.
Okay. And then they were going to check your motion or movement of the knee, right?
You guys had sent one of those machines home that moves your leg. And the first day I was up to 120. So
like 120 is like really good. So that's 30 degrees past a right angle, right?
Yeah.
And so you've done pretty well with this. You're
Yes.
back in your work clothes. You do
Yes.
plumbing. So
Yes.
you're moving around. Let's stand up and walk toward the door. And everybody wants to see how you do. That's pretty good. Come on back toward me. So I guess you would tell people if they need to get their knee done and it's bad, get it done. Is that right?
Yes.
And there is a little recovery time on the therapy, right?
Yes.
You got to work hard. Your surgeon's got to work hard. But
Yes.
if we all do our jobs, we get a good outcome, right?
Yep. If you do your therapy exercises like you're supposed to.
All right. So you'd recommend a robotic knee replacement to people?
Yes, from Dr. Urs.